You're good.
Hello, everyone. My name is Dr. Kait Chang, naturopathic doctor and Calgary menopause wellness practitioner. I have Kari Klein with me on the video today, and I'm so excited to introduce Kari to all the women out there who are working through their transition in menopause. Hi, Kari.
Hello.
Hello. I'm so excited you're here.
Thank you.
So let's dive into about who you are and what you do. So what's your background and how did you find yourself in becoming a transformational coach?
Well, for the last 16 years, I've actually been a licensed practitioner, right? A chiropractor by profession. I still have a very small practice. It's just not something that I'm actively, growing at this point as I am doing a transition of my career. But what initially took me to chiropractic and what kind of probably ends me up here is and I've spoken to this before with you, is just my natural curiosity about, who are we and what are we doing here? It's like the big life questions, right? Like, who am I? But I always had a love of science. And in my undergrad biology degree, I would say that I had a couple of experiences that have kind of shaped me and kind of wound me towards more of a holistic view of the body and where health and healing comes from. And it had to do with, being immersed in immunology and just being fascinated that, our immune system is an entire universe unto its own. And it is, the deeper you get into it, the more miraculous you see that we are as human beings and life in general. And and then, choosing chiropractic came from a philosophy that, the body is self-healing, self-regulating, and self-directing. And that really spoke to what I learned in my immunology and my science background. And so it was like, wow, what if I could pick a profession that actually supports that? And so that took me, years into clinical practice with patients. And as a chiropractor, I've been able to connect with people at a greater degree, I think. I think that was part of my pull to the profession, is that you really do get a wonderful connection with the people that come into your office. And I often say I learn as much from my patients as, potentially they learn from me. And it's a wonderful exchange. And in that process, it's brought me to this place of seeing, after watching chronic health conditions, I'd say primarily, that I wasn't making as big an impact as I thought I could. And, when you go into this health game, there is a piece of you that wants to, leave a mark of impact. And I started to see the mental prisons people were locked in that then was perpetuating the health conditions that they were having. And so my transition now, it was to give people an opportunity to have, play in a different realm, to see if there is a different way that their world could show up for them, thereby their health following that. So
it sounds like you're your own patient and you had that critical tipping point, like, what am I doing here? And that led to a lot of self-discovery. Always. Is that right?
Always. Yeah. I think that's most everyone. And, I had a pretty significant, we've all had our life experiences. I'm not a spring chicken, right? I'm coming up on 50. So I've had some life behind me, but also I had a pretty significant experience in my late 20s where my husband was diagnosed with cancer. And from time of diagnosis to his passing was 6 months. And that was fast. And it was like one day you're facing one way and the next day, you're looking the other direction. You're like, well, I didn't actually get to choose this. So through a pain point, a deep dive, and kind of coming back from that, I think there was a part of me that wanted people to avoid, right? There was a piece of me, even being in health, that I wanted people to avoid that deep part of suffering. But the truth is, being here and being human, a part of it is, for you to get curious, there has to be a little bit of a tension point where you go, wait a minute, is this true? And I think, I've had a couple of those, but that was probably the biggest that framed me. And to see that I actually can't save people from their own suffering, but what I can do is point in a different direction.
Yeah, I see that in my practice all the time, with people coming in with a physical ailment, whether it's hot flashes or night sweats or arthritis. I think it's not just like we talked about, it's not drugs, it's not supplements, it's not just, let's say. I mean, there is a place for, external intervention, but I think healing really comes from the core, the heart, and that's where the root cause is of ailment. So, well, I did not know about your past with regards to your late husband.
Yeah. It's
Yeah.
everyone is dealt a different hand in life, right? And
I can totally relate to that, because my father's own passing, and I think things kept coming up over the years. Like, you would think that you got it down, but it would keep coming up, right? And I think that's a very human thing that many people experience, going through pain and, I don't know, trauma, but that's just part of our journey, being human. And my next question for you is that what's involved in your training into becoming a transformational coach?
Well, this is probably where School of Tough Knocks comes in, right?
Okay.
Well, I mean, obviously, I've been with patients, I've seen it over and over about what is happening for humans, right? I'm with humans every day, what they're up against, the struggles that they're having, and included, I'm a human, right? Having my own life experience over here. So I'd say that there's the education and schooling in amongst all the things I've learned in my life, in addition to my professional designation. But if you even go beyond that, a lot of my colleagues would be like, yes, I'm a doctor. And I'm like, well, rubber meets the road now. Like, anyone can get the degree. It's the experience of actually being in that position, right? In that role of, caregiver and support and guide for other humans, where I think most of my growth probably has come from. Then there's the personal development. I've always been involved in personal development. I've had a few really pivotal things that kind of, shifted me. And then just had a massive insight after I had a real down point in 2017, and could feel that my mental health was on a slide that I couldn't stop. And that was actually really hard for me, because I know physiology. I know actually what's going on. And so that was even more worrisome for me, because I'm like, whoa, I can't even seem to stop this. And I suddenly read something that it just flipped my world, in the sense that I've been coming from a place in healing from the inside out. So healing happens, it's an inside job. You can take external things, right? And your food matters, and your hydration matters, and your sleep matters, like all of those things matter. But, the process of the actual healing, like cellular healing and shifts, that's inside, like that's happening automatically. We have an intelligence in the design, right? And so, but the thing that I missed throughout all the innate intelligence stuff is that is also thought. Our brain is also subject to that innate intelligence. And I kept thinking I was overriding it all the time. And that was my full-on epiphany of like, oh my gosh, like this reality that keeps showing up in front of me, which looks similar day to day, I'm at the creation of it. And it was really big, like, whoa, but there's an intelligence behind it. Like, I could actually lean back into that and actually witness it. So that was actually, that was probably one of my biggest components of my discovery. And then, I don't have an official coaching certification. I kind of feel like 16 years of doctoring is kind of certification enough. However, I'm doing something very different. Like, I'm not doctoring anymore. I'm not diagnosing. I'm not, it's more of an exploratory discovery conversation. And every one of them is slightly different, with a similar basis for understanding. So it's walking people to a new understanding. Yeah.
Right. So your approach is more fluid.
Very fluid.
Right.
Yeah. Because for every person, right, what they feel they're up against or what their problem is can be quite different. Although when I first started this, I did it as a group program, because as you've experienced, you have patients, individually in a room, right? And there'd be days where I'd finish. I'm like, man, if I could have put those 12 people together in the same room, they would see that although they feel their situation is unique, pretty similar.
Right.
And so the group thing was really lovely because people could start to feel like, oh, it's not just me.
Mm-hmm.
Yeah.
Mm-hmm.
I do find though that the individual there's a little bit more of a momentum that happens because you're one-on-one and they're getting through their stuff quicker. So I do like the one-on-one, but I love group too. Group is fun. Yeah. Group is amazing. It's supportive and it gives people a sense of, I'm not alone.
Right.
Yeah.
Wow.
Yeah.
You mentioned in 2017, you had that breakdown moment. How did you know if that was, things not going right in your life, or was that a menopause related hormonal cause?
Right. Or all the above, right?
Yeah. Or both, right? How did you know? Yeah. Maybe it is both.
Yeah, I'd say it was a bit of both. I mean, a little background of my story is I ended up, luckily I found, another wonderful human to share my life with, right? So I've remarried but we met late. I was 39, and that, that clock ticking thing that you never think is going to happen. It kind of felt like there was the pressure behind it. Like, could we have a family? And I guess fortunate enough, right? I ended up having a little guy, but I was 43. So in amongst building a practice and having, a previous decade of stress after losing my first husband, my body was probably not in the best position. There were some things I was doing that was very helpful. And there were some parts where I was probably low on resources. So I knew my body was probably struggling on the progesterone end of things. So I did have some support with that from a naturopath. Mm-hmm. But then to have a baby, interestingly enough, I felt the best I'd ever felt, like in almost a decade and a bit, right? When I was pregnant, I was like, whoa, pregnancy, let's just stay pregnant. Like, I feel so good. And that was because my hormone levels had come right back up, right? I was like feeling really good, had a really great pregnancy. Through nursing, I mean, not that it was not difficult. I felt still good. And then to stop nursing, what happened, it's like my body and brain fell off a cliff. It was like I went from the high of hormones to the low of hormones, where most people would maybe spread that perimenopausal space out over 10 years. Mm-hmm. Mine was condensed like crazy. And then I'm already in menopause, right? 5 years. It's fast. It's really fast. So that's certainly what played into some of my mental strain and stress. But I would say a majority of it was my view of life. But I'm not opposed to getting support. Like, I didn't come to you per se as a naturopath, but I've been using naturopathic medicine for almost 2 decades now, right? As a support measure of, where can I balance better? What can I do, right? IVs, natural supports, vitamins, all of those good measures. Yeah. Mm-hmm. Yeah. And can still run into the place where you hit like, oh my gosh, what's happening?
Oh my goodness. Yes. So in my practice, most women coming in to treat their hot flashes, let's say, or insomnia, I see that. I see it's not, okay, here, let me give you some melatonin or GABA, or let's boost your progesterone. It's beyond that. And it could take a long time for women to see that that's not what they need to work on. And it's more on their perception, like you were going through, is working on the way they view the world and how that's impacting them, and how they can step out of that mindset and then heal from a different place. So
that's a great way to say it.
Yeah. So what are the top 3 themes that concern menopause women that you see, regards to health, to relationships, mindsets, finance, maybe? There's a lot.
A lot of it, but I would say I kind of wrote down 3 because I was thinking, like, what are some of the main conversations? And I would say I'm a huge advocate for women to make sure they feel heard. Because what can start to happen is you can start to feel dismissed. And that dismissive piece of, okay, well, maybe they're saying like it is in my head. But I'm not telling women that it is in their head. Like, even if you look at mindset, I really have them ground into the fact that, no, they are noticing a difference. And that is true for them, to not actually get caught in the place of, well, it's just in my head. You know, that like, well, my doctor thinks it's in my head. Yes. And you are experiencing something, and that is real for you. So to not dismiss it. Right. And then, because then the frustration show up, and I didn't want my patients to get frustrated. So I always gave them, I said, I don't know how it's going to, what exactly is going to work, but I want you to know that I want you to trust how you are feeling, and I want you to keep speaking it, and we just keep on search for it. So that I felt that overall there was a lack of support and direction for women. So I tried to be a resource for them, if anything, right? Of a resource of places they could go. And if it was someone to talk to, perfect. And if it was someone as a naturopath, awesome. If it was an acupuncturist, TCM, awesome. Like I really wanted them to start to feel it out for themselves too. But I would say overall, the overarching is there's a lack of support and direction, right? Kind of feels like there's one way to do it. I think there's a big misunderstanding about the process and the varying symptoms, right? The presentations that show up, and, you know, you hear the general or the main, you know, hot flashes and, you know, kind of memory loss. But, you know, there's just a lot of other things that show up and hormones play so big. I remember when I finally went and did, and I'm not sure actually if you do the Dutch test. I'm a real fan of, you know, testing those hormones. And I encourage any woman who's had a child to go, even if you haven't, right, to at some point go have your hormones tested. And saliva and urine testing is quite different, right, than blood testing. But also that once I had mine tested, I saw that like the difference of where I was supposed to be in balance and what was happening for me. It kind of just a little bit more validated why I was feeling the way I was feeling, right? Or for women, whatever they're struggling with, to know that there could be more of a hormonal base, and that anxiety and depression are often more of a manifestation of poor hormones than they are the actual cause of the mental issue. And I remember saying to my naturopath when I discovered, because when she said, I have your results, I was like, oh God, please tell me there's something on that test. And she said, bring a notebook. I'm like, oh, I was actually happy. I was like, oh shoot, great. Okay, good news. But I remember when she said it to me, I said, well, how many women right now are on antidepressants and anti-anxieties when it's actually hormones? And she said millions. And that was really saddening, and, you know, sad for me. And I'm like, so that can be more of an end result of hormones being fluctuating and not doing well over a period of time. So I do try to make that quite apparent to women. I don't know, right? Because I don't do the testing. I tell them though, but consider that potentially some of the symptoms you are feeling could be hormonally based, and let's just make sure. That's
right.
one of it. And then the third one was kind of like expectation and managing it solo. Like we're not alone. Right. And if we could start to have these conversations more, like I'm willing to have, you know, I in my family, I'm known a bit as a TMI girl, but like there are things that have happened for me that I'm like, why is no one talking about this? And then I went to a talk about by Dr. Jen Gunter. Have you heard of her? Yeah. And she wrote the Vagina Bible. Like everyone should read that book. Everyone. And she started to realize as an OBGYN that, you know, everyone's talking the same stuff. They would share it kind of shamefully in the office by themselves, but she's like, this kept happening. It's common. And so we're not solo. So I think hopefully the voice just raises more and more that people are, you know, there can be intimacy issues. There can be mental health side effects. But that also doesn't mean that there is something inherently wrong with them. Right. Okay. So that'd be one of my big messages. Yeah. You can feel off, but it doesn't make you wrong. And it doesn't mean this is forever.
Wow. That's awesome. So there was a lot that you had mentioned. Yeah, it just makes, so it reminds me of, we're in this era where women are what is it, are groomed to be independent from your generation, my generation, and that independence, that ability to do things on your own. And I can see how that can really bleed into menopause. You know, the fact that we have to have a career, or not have to have, but we have aspirations, and you know, we have a family, or maybe not, but being able to take care of yourself, right? All those things in our 20s and 30s, and before menopause, really before, I don't know, before 50s. That solo piece that you mentioned, I feel like, it's not conflicting, but you know, having a transformational coach like you can really help us and guide us into from being independent and self-sufficient to being able to receive love and help and support from others. And it's a big transition. Even, you know, women in your age now, you're saying almost 50 compared to a woman my age in mid 30s. So I feel that what your work is really important, and it needs to be. I wish that more women would know that there's resources out there, and things like the things that you really cherish is to share with others. That's really awesome. Yeah.
I mean, if it really, if there's a softening that comes in closer to 50, I think you and I were talking about this. I know I can't swear on here, but you know, the F at 50s. Like, I remember when I finally just got there, I was like, I mean, and I still hear a little piece where, you know, maybe I care about that, but gosh, that would be lovely if that happened at 35. And you just were like, oh, you mean I can just be me and I'm okay? That actually might make menopause and the shifts feel so much gentler, because it's not a weakness that's showing up.
Yeah. How do you get women who are, like, you use the word cerebral?
Yeah. Very.
Or it must be my hormones, right?
No.
And I only need, like, maybe I just need hormone replacement therapy, or give me something. So I can feel like my old self again. How do you bring those people? And I think you had talked about, you know, bringing their attention to reading some books first, and so that they can start in a place where they're more receptive to your guidance. How do you do that? Because I see in my practice, and you know, I have women coming in and they're here for, I don't know, insomnia, and they just want a quick fix. And I mean, this is not bad, and I understand because they're in a lot of pain. But you know, how do you bring that to their attention, that it's not how do you do that? It's not just it's not that straightforward.
Well, I think it comes back to that understanding. If you know that your thinking is informing your physiology, like if you knew that, more people then look in that direction. But most people feel separate, right? What's happening up here is very separate than what's happening here. And I'm like, it's not. It's actually all one. And I often will describe it as that you have this body, this physiology that's in form, but how it's being informed through its nervous system is through a lot of our thought processes and experiences that we sit in front of it. And so your physiology is really just being reactive to your thinking of what's showing up in front of you. And so and you're right, if someone's struggling with insomnia, first we have to get them, you know, a little bit more sleep, because you know, you can't actually think well when you are tired. And there is those stressors, but it's a little piece to pointing in a different direction, that if you took time for yourself and you were able to give yourself some space and allow yourself to settle a little bit more, and then got the supports that got you sleeping, knowing that you're going further upstream, meaning that you don't have to have, I don't know, there's a lot of people like, well, I'm just going to be resigned to the fact that this is how it is. And I'm like, no, like your body is designed to keep, go. You don't have to hit 40 and it's the downhill slide. Like I tell people, you cannot talk that in my office. Like we just don't talk that, because that is you informing your body that you've hit 40 and you're on the downhill slide, and it'll go, oh, are we? Like, don't do it, and of course you get you're maybe a little less flexible and things like that, but that doesn't mean that it's not possible.
It's all in the head. I know it's such a bad phrase, but I can really relate to that, because my mother, she's from, Taiwan, and her background or her upbringing has this understanding that when you are in your 40s, you're into your seniors. Isn't that crazy? And that was the perception I had growing up is, you have your kids in your 20s, and in 30s you have your career, and then 40s like when you're winding down. And the society has changed so much that so many people don't stop working. And so I see that in my mom, because my mom is in her mid 50s, and sometimes the things she says, and she's menopausal, she says it's like I would not hear that in my group of people who may be older than her. They might actually think they are in their, they talk like they might be in their 60s or even 70s, but they talk like they're still a big adventure for them, and they have vision for themselves, right? Whereas my mom is only she's already doing that. Like she became a grandma in her 40s, and to her that's a symbol of old age, when she was only like 48 when she became a grandma. And so she's like, I'm getting old. And then she would succumb to some of the ideology revolving old age. But she is not. She's not old. She's only 55, 57, or sorry, 55. And but all these ideologies she has, she believes about who she should be at that age, really comes out in her behavior. And she, of course, she has the associated health issues there. And it really takes a whole town of people to really help her and see where she is. And but I think how the society is really we're in a transition time in the whole society to see ourselves as women and how we interact with the society. So what does a session with you look like? Tell me, go with me, like go through the process of what's involved when someone comes to see you.
Well, I mean, it can happen a number of different ways. I mean, and often it happens in a conversation, and usually we have to sit, it can be in Zoom, right? It can be, so I can do it from anywhere and, or it can be in person, which is lovely. And I think stepping into this, some people have a little bit of trepidation, a little bit of fear, like, oh my gosh, what's this going to be? Is she going to unravel me? And I'm like, the truth is the process is actually pretty gentle. But people feel like it will be scary, right? And so they have this thinking about that it'll be this like whole unraveling of myself. And I'm like, well, the cool thing is I think of it more as a revealing of self rather than an unraveling. But it is in a conversation, and it's in a listening. I listened for what is underneath the problem, because the problem's just the external thing that they feel that they're up against, but there's usually a deeper driver.
Right.
And so if you can listen for that and then, ask into that, and really the only thing when people come to the conversation is they have to be open-minded to hearing something new. Because if you come with what you already know, or you're just looking for information, that's actually not where transformational shifts happen. They happen through insight, and insight will happen in a place that you don't have an awareness yet, right? But you have to have a different listening for that. You have to be open, right? To go, oh, like I've never considered that, or oh, well, that could be true. Like, you can see people in the conversations. And so typically I usually have a short chat with people, because there's sometimes for people, I might be too much. I get it. Like I might not be their first entry point, but I love meeting with people, and I will always meet complimentary with people. And I usually find out, what's going on, what's been happening, what are you looking for? And if I know that they're just starting on the journey, I may actually recommend a book. I may actually recommend a podcast, which is awesome, because then they can do it on their own time and they don't have to feel, worried, and they can do, and they might, who knows, follow me. I have other people I follow. I tell people, when you follow me on Instagram, you'll see who I'm following. So then you can kind of look into that as well. And that's how you build the community. But if someone's at that place where they've kind of hit that suffering point where they're like, I am kind of done with how this is going, then there's potentially an opening, right? We talked about the other day, there's a little bit of a chink in the armor. It's like, okay, if you're curious, let's talk. And that happens in a conversation. It's usually a couple hours. I'd say my approach is pretty gentle, but I'm a little bit of no BS, in the sense that if someone goes, well, that's really hard for me. And I go, well, if you think it is, it will be. Right? Like, I'm not going to sit there and placate to, our old thinking, because you can never have a shift in who you are if you're not actually considering that there could be a different way of thinking. So there's that, but there's a gentleness to it, right? For sure.
So I'll let whoever is watching this know that I had an experience session with you, and I felt your approach was really gentle. Like, when you even if you were to call me out, it was so gentle. I didn't even notice I was being called out at some point.
Maybe it's one of my gifts. I'm not rude. I'm not mean. I do throw the odd F-bomb in because it feels good, but I'm not where I see the end result is my job is not to be brilliant. It's for me to show you how brilliant you are. You need to see it, not me.
Right.
I already do. So that's the fun part for me, is that I don't have to be a hard ass at all, but I'm not going to let you, wallow. I'm like, that's not who you are. I know it's not.
So while we were going through our sessions yesterday, honestly, and you talked about, it's a conversation and you're bringing people to the unknown, and so that we can explore it for ourselves. It's very uncomfortable coming out of the session, because our brain are wired to want to know. So what's the next step, right? So what is the conclusion? And I think we talked about, and I still feel like it's been, 24 hours after, and I still feel like, I don't know what's that. It's really blurred to me, but I really trust it. I trust that, okay, it'll come to me. And I think with my own experience as a therapist, I say, or a healer, I understand the value of sitting uncomfortably in that space of just not knowing, with the uncertainty of where this journey is taking you in. But you have that faith in guiding you to the light, I guess. Or
even a lightness. Right?
Lightness.
There's even a lightness, right? Like some people, they would hear light and they're like, oh, I'm not into that. But there is a lightness to all of the controlling we do to try and manage our circumstance that's in front of us. But what if there was an intelligence in the design that already has you?
Right.
It wasn't actually up to you. That's something to consider. It might feel uncomfortable at first, but in time, it is so comforting. I feel so wonderful now knowing it's not fully up to me, and I have a wisdom that I couldn't hear before because I was so busy controlling the circumstance and the outcomes, right? So it's a little bit more of reframing that for people to, I don't leave them in the uncomfortable, right?
And so how many sessions would someone require to have that shift?
Well, here's the interesting thing. I do these experience sessions. I do them complimentary. It's just my business model and what I do. I've had people who have just done the experience session and they got what they needed. And that's my gift. Like, cool. Now they may want to, go be with that for a while, and maybe they circle back around a year from then. They're like, wow. But like, I had a teacher recently who had gone off on stress leave last year, and she's been a patient of mine for a long time. And I have a deep love for her. And so I said, are you willing just to kind of explore, like, would you play? And she did. And she has found that going into the classroom now, despite the conversation that's happening with government and teacher cuts and, the pressure and the class sizes, like, she's back to having joy in teaching. And that was one session. So for some, I never tell people, I don't know what it will take. I don't know exactly what people are coming to the table with, but it's always fluid for me. Some people will go, well, I just don't know if I want to sign up. You don't have to sign up for 3 months. But I would say people who do a little bit longer, you're going to move through it with a bit of momentum.
Right.
But that doesn't say that's for everyone. So that like for you, even you were asking, and it's like, it's really personalized based on what it is you're looking to explore. That's all.
Yeah, a lot of teachers are on stress leave. I have a couple patients on stress leave, and I think their work, I mean, we're not teachers in the, you know, the traditional way of teachers, what that means. But yeah, I think that's really interesting. Now I have someone to refer to you now.
But the burnouts, you know, like helping professionals, I would say where I have a love and a compassion for is the helping professionals. So that doctors, nurses, teachers, because there's just real in that give category. Mothers fall into that too. Like the give category where they don't actually hold their cup full and they're dumping from both all the time. You cannot come back from being empty on both tanks.
Right.
So it's, you know, it's distinguishing a little bit of that, but also finding out, I would say for me, I was on adrenal supplements forever. The other part of it is when we're using our carbon fuels and we have our foot on the gas and brake all at the same time, go, 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 stop, stop, go, go, go. And then like, what if you had wind power? And so I'm actually taking people to more their wind power, and it doesn't dissipate the way carbon fuels do in our push, in our drive, in our ambition. If you had wind power and then you just had a dream, you wouldn't be so pressured to have it happen in half a year, because you'd have this expansive energy.
I love that analogy. Wind power. I feel like my world just opened up when I was imagining the wind power. I'm like, oh yeah, just let it flow.
Hey, there's a bit of flow to this, right? And it's like, it's playing into that, which I think made all the difference for me, because I was on adrenal supplements for 12 years. And I don't know that they made, I mean, they helped me function. I don't know that they helped me thrive.
Right.
So there was a difference.
Yeah. I'm on adrenal support supplement as well, but not 365 days a year. I take it where I need it. When I go on vacation, when I'm just feeling like I don't need to be go, go, go. I've stopped my adrenal supplements. So that's amazing. So you had talked about the complimentary experience session. Where can we find out more about that? So my, pardon me, my website is kariklein.ca.
And you can go to just at the very top of that website, you can say schedule. Typically I do a little chat first, because I'm not going to dive someone in when they don't know me right away into 2 hours. Right. So we usually will do a short chat session. I'll connect with them, and then we set up a short chat, usually by Zoom. And then if it's feeling like, wow, this is exciting and I really want to do this, and they feel like they've already taken some steps, or they're at that place where, you know, the shift, they just feel like, okay, like it's time. I need to leap and do something a bit different. I keep hitting up the same wall. Then we schedule a session, and that can be in person. It can be on Zoom. I like Zoom because even though it's technology, you still see people, you see their expressions, you see their shift in their physiology. So it's a real gentle way too for people who are a bit nervous, right? So it's a real gentle way to be in their jammies at home, and they don't feel like, right, they have to be out in a coffee shop.
Right.
It's like that. But you can schedule that. They can always email me. It's the same ending, but it's Kari, Kari at kariklein.ca. And I'm just out sharing, right? Like it's going to happen one person at a time. I spoke at Teachers Convention, and it was fabulous. I had about 40 people in the room, and then 11 people signed up, and I did a continued conversation, and one person showed up, and like, her and I had an amazing conversation. And that's what it is. I'm just trusting that the right people are hearing it at the right time. And so I'm not forcing it. That's for sure.
I can really appreciate all the work you've done on yourself because here we're talking about your website, and you're like you're opposite of trying to tell people sign onto my course or sign onto my experience session. You're like, just hold on. I feel like there's this not caution, but it's almost like you're pushing people away, and not pushing, but you're holding people off, let them discover what they want. And in a way, it's like, no, I want that. And the more we want it, the more like, no, just wait a little, see if this is really right for you. So I almost feel like you have some sort of magic there. Because the more you say that, the more like, no, I want to sign up with you right now.
But here's the thing, that's human nature, right? We want the quick fix. And this actually is a much quicker fix than people will ever imagine, because they think change is hard. But the truth is, I think my 16 years in practice is what's brought me to this place, that the most gentle of approaches is what allows people to recognize in themselves, am I ready? When I slow them down, they really get tuned in. And when you get tuned in, you might find I'm a good fit, or you might find, you know what? I don't know. I need to take a sabbatical from my work. I don't know if it will be me. Right. And so it's nice to slow people down so they can hear their own wisdom. That's really, I'm not trying to do it as a marketing strategy. But it really is, the more you slow people down, the more they actually hear their own knowing. And if they're ready to leap, then the conversation will be something they want to walk into, but it's not required.
Yeah. That's amazing. Thank you, Kari, for sharing what you have with us, with the world. And thank you for being on this interview. And I think what I'll do is I'll have your email and, or actually not your email, your website listed below the interview today. And then, we'll see where things go.
Great. And I'll look to maybe add it to my website, right, where it's double linked. And then, you know, the more you get the conversation out, the more we create a community. I guess that's, you know, when you and I met, I mean, it really is, how do we create this community where it's not necessarily because I already have a conversation going with a community. It's not so much that I want to lead it forever. They're already lifting each other. And if we all just rise together, it just makes such a difference than it feeling like there's this strata, right?
Wow. You're like the small woman, and I feel like you're lifting a lot of people.
Hey, and here's the thing. It used to feel like heavy lifting, and now it doesn't, because it really is rising. It's fun. It's fun.
Thanks, Kari.
Hey, you're so welcome.
I'll wrap up here, and I'll talk to you soon.
Sounds good.
That's all. Thank you.
Okay. Thanks.
Bye.
Bye.